Hello, my name is Dr. Kimberly Burns. I'm the Director of Pharmacy Services over at the Western New York Children's Psychiatric Center. This presentation is about our longitudinal APPE experience opportunities, which are the hospital health systems pharmacy, as well as an elective and either direct patient care or non-direct patient care. Our hospital is within the New York State Office of Mental Health Hospital Systems. Over here, we work predominantly only with children. So we have 46 beds in our inpatient facility. We service those ages 4 to 18 years old. We cover 7 counties of Western New York, and we also have taken children from other areas of the state as well, if they feel that some of our providers better suit the needs of those patients instead. We have a variety of outpatient clinics, our biggest one in Amherst by the Wegmans on Alberta Drive. Most of the rotation, if not all of the rotation, would be done on site here from 7:45 in the morning to 4:15 in the evening. A couple of community outreach opportunities might be available, and a couple academic opportunities and lectures from other disciplines are available at the outpatient clinic periodically. A typical day here would be attending morning meeting on an assigned unit. So our facility has 3 units at the hospital, but we found that it was better if a pharmacy intern just predominantly tracks on 1 unit. Average length of stay of our patients are around 90 days, so you can really become integrated in a patient's case beginning to end by following just one specific unit instead of bouncing around. In the pharmacy, we'll assist in medication distribution to the units. We have medication carts. We are also in the process of developing our Pyxis program. We have inventory activities that range from daily deliveries to monthly controlled substance inventories. So there's a lot of different activities with inventory available, as well as with our Vaccines for Children program. For quality management, there's opportunities monthly to see our crash cards, nursing inspection, nursing unit inspections, medroom inspections, clinic inspections. Other more diverse projects include topic discussions, journal clubs, presentations. DI questions pop up randomly. You might get 1 a day, you might get 2 a week, you might get 1 every 2 weeks. It depends on the acuity of some of our patients and really what our psychiatrists and pediatricians and clinical director are looking for. So it's a real lot of specific questions, not so much like busy work we need to knock off an assignment type of deal. It's really useful types of drug information questions that can impact a patient's treatment and care while they're here. Other activities include attendance at our facility committees, so predominantly think of like pharmacy and therapeutics, infection control, antibiotic stewardship, etc. We've also done more lighter things like lunch and learns and other activities with other interns of other disciplines like the psychology interns, social work interns, etc. As far as interprofessional engagement, we are a smaller hospital, right? We're only 46 beds compared to some of the much larger facilities in the area. So we're very we're a very intimate group of providers, I guess you could say, as far as how much we work together towards a patient's well-being and care. So at our facility, we have psychiatrists, pediatricians, psychologists, social workers, recreational therapists, and occupational therapists, mental health therapy aides, nurses, and nurse practitioners, to name a few. And we all play our own different roles in helping a patient get better. And it's really interesting and a really great opportunity for students to be able to see what these other people, other professions do in a more intimate environment versus being in a larger scale institution as well. What we're looking for in an applicant is, or somebody who's interested in coming to our site, or somebody who's a strong communicator. There are a lot of opportunities for patient counseling, patient engagement, speaking with family members and caregivers. So we really need somebody who's comfortable in their own skin to be able to talk to somebody else. We also have a lot of opportunities for those presentations, drug information questions, and talking with other disciplines, especially the psychiatrists. So we need someone who's able to have a full length of the spectrum, running from being able to talk to a 5-year-old about their medications to a psychiatrist or a psychiatric fellow who's been in the field for some period of time. We also need somebody who's an independent worker. We are not the type of preceptors who are going to micromanage. Once you get your assignment, we need to know that you're able to work on it on your own, being able to figure out when things are due and how to manage that. Also, if you are attending morning rounds and something comes up and you are asked a question by one of the other providers, we're not there to hear what they're asking you, so we need you to be able to take it upon yourself to be able to answer those questions and to, add that to your agenda of what you have to do. We also need students who are multitaskers, so sometimes things can come up at a moment's notice. So we might have a spur of the moment discharge or spur of the moment admission where it's all hands on deck and things need to be changed right away, and working on your project might need to be put on the back burner to facilitate filling for prescriptions for somebody. So somebody who's able to really track what's going on in all their other projects. Not to say that all of your assignments are going to be assigned on day one and you have to go there, but and finish them or worry about them, but it's very unlikely that, here's your DI question, that's due on Friday, and on Friday I'm going to assign your case note. Like, you're going to be handed a lot of projects and different tasks to be done rolling through the experience, so being able to handle that responsibility is important. And obviously someone who's interested in psychiatry would be a great or better fit for our facility. I will say that some of the more interesting aspects about my job here and some of the more interesting aspects of some patient cases are the ones who have complex medical comorbidities as well. We've seen anything from, Crohn's disease and IBD to we have patients receiving oncology treatments from OSHI. We have cystic fibrosis. We've seen a lot of different things. So while, yes, we all love psychiatry here at this hospital, some of the medical stuff is really fascinating as well. Almost all of our patients are also managed on some type of metabolic management as well due to weight gains from antipsychotics. So that's also something that we see a lot of. So there's a lot of medical followings here. With that as well, I'd like to point out that it's helpful if you are able to understand primary literature, be it how to find it, how to evaluate it, understanding general concepts and statistics as well, because so much of the medications we use are used off-label, and we need to make sure, one, that if we're using it off-label, there's a reason to use it off-label and it makes sense. So being able to really get into primary literature is a huge, one, it'd be a huge strength if you feel comfortable doing that to begin with, but two, that's also something that I feel you can leave this rotation being much better in. So enough about our site. What's in it for you? So I feel as a student coming here, you'll see a lot more interprofessional activities than you might see elsewhere. There's going to be a lot of opportunities for engagement with families, caregivers, and patients. Every time a patient leaves this building, they are provided medication education to either themselves or to their families with them as well. Anytime a patient goes on pass, so if they want to go to a friend's birthday party, they have a wedding to go to, or some other type of event and they need to take a medication with them, we'll talk to them. Or if they go on leave, which is like a practice home visit for discharge, so they might go home for the weekend or for a holiday and they need medications, we've also touched base with them there about that. So there's a ton of counseling opportunities for students as well. And if you are interested in psychiatry, this is the place for you. So if you want to potentially do a PGY2 in the future, or if you think you're interested in that, if you think that you want to go on and get your BCPP, there's not a lot of places out there that can provide you with so much exposure to children's psychiatry. Yes, there's psych facilities and other psych units in some of the hospitals in the area, but you're not going to see so much focus in children. So this is a really niche area. So if you think this is something you're interested in, we're the place to be. Children's mental health truly matters. With the COVID pandemic, a lot of things shifted with, mental health care kind of getting thrown to the wayside. But now that we're out of the woods with that, there's a lot more evolving with mental health management in children and what we understand from that. So it's just a really great environment to be in, and a lot of things are changing in this area of healthcare. It's a very fulfilling hospital to be in. It's a very fulfilling thing to see when you have a patient coming in and getting treated and then walking out the door almost a totally different person. So there's a lot of really special and a really lot of great things to see at our facility. So thank you. I hope you are interested in coming to our site, or if this sparked any more interest or questions, please feel free to reach out to my email below. I'm looking forward to hearing from you and looking forward to seeing a few of you on rotation next year. Thank you.